Okay.
Yes. Hello, everyone. Welcome to The Social Doctor. And this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from experienced medical practitioners. And today we have a very special guest, Dr. Jeegar Dattani. From his experience in the pharmaceutical industry for more than a decade now, and he is currently, heading the medico-marketing space for an international pharma agency, and he is there in Thailand right now. So he has connected with us today, understanding the kind of opportunities and the kind of career growth that doctors can see in pharmaceutical industry, how they can think of going forward and entering into the pharma space after their graduation or post graduation, and what kind of career growth and expectations that you can have when you enter into the pharma space. So welcome, doctor, to the platform. It's really nice to have you here.
Thank you. Thank you so much, Dr. Ayushi. It's a wonderful platform that you created. And I think we were searching for such platforms when we were taking off in our careers, but we didn't have anything. So I think it's very thoughtful, and thank you for giving me this opportunity to be on this session. And I hope it will help our viewers make better decisions.
Definitely, and it's a pleasure for you to be here. So without any delay, let's start. How did you start your journey, and how did it click you to enter into pharma?
Yeah, it's quite interesting. So I passed out my BHMS from Mumbai from CMP Medical College. I passed out my homeopathy back in 2012, and I was a first generation medical doctor based out in Mumbai. So while I was very keen to pursue medical practice, clinical practice, like every one of us wants to, but I was certainly looking for exploring opportunities to support my early days of practice. And that's how I had got into teaching during my medical student days. So I had taken up teaching opportunities in biology. There were plenty of those in Bombay back then. And during my stints in teaching, where I had a chance, and this was all freelancing while I was still, I think, a third year or a fourth year student or an intern. During this phase, I realized that I really enjoyed trainings, and I really enjoyed communication, and that's how I found my passion in communication and training and things like that. And however, my only little bit of a hesitancy about teaching was that I felt that over a decade it doesn't change, right? If you're teaching a cardiac cycle, the cardiac cycle doesn't change forever, so that could get a bit boring eventually, and it would not excite me. So that was a period of time where I was trying. I felt that communication is something I really found my passion in. Training is something I really found my passion in. But how do I utilize this in a different way? And then I was looking at options across insurance, pharma, everything. During the same time, I was working with a MD medicine physician in North Bombay, and he was the one who guided me. So actually, to be honest, he was my mentor, and he changed my life. I was really lucky, and I'm very grateful to him. His name was Dr. Jagdish Gotur. He was an MD medicine, and he was associated with pharmaceutical companies because he was a very senior physician of North Bombay. So I was very close to him, and I used to work with him regularly. So I shared with him the things that I told you, that I'm enjoying this, but I think this will get boring after a few years. I'm looking for more options. I'm exploring to do masters in public health or health administration from TIS, which is a wonderful institute. I was even preparing for that. So he told me, he was the one who suggested me first time. He said, you could get into something like pharma, and like when you could get into something like medico-marketing, where you could club your medical domain knowledge and you could club your communication skills. And I was very surprised. I wasn't aware about it. But again, I got support and I was able to do a volunteering experience with a pharmaceutical company back when I was an intern. So I think it worked for me that I got an early start. And then after that, obviously, I did my MBA, which really helped me. And I started enjoying what I was doing. I was able to club medical and communication and training. So I think eventually it fell in place, to be honest. And then I took up the relevant upskilling courses. And then I think one thing led to the other. And that's been a nice journey with lots of ups and downs. But yeah, 10 years finished and enjoying it.
No, it's very nice to know how it went. And so we are here to discuss. So, now what do you suggest to the current medical graduates, who think that pharma is a good space for them and want to enter into this space? Are there any kinds of certifications, courses that you suggest that they should do, or they can enter with their basic graduation courses?
So I feel courses will help. Because so if I just give an overview of how pharma is, okay, pharma has different departments, and pharma has something called as marketing, something called as medico-marketing, and in some companies it is called as medical affairs, and there is something called as regulatory, and there is something called as pharmacovigilance. So these are the four areas in pharma where medical graduates can get entry. Now, if we look at these fields were always there, but earlier these fields were totally utilized by pharma graduates, especially masters in pharma graduates. So even today, if we feel all these domains have a mix of people. There are people who come from masters or a PhD or doctorates in pharma, and then there are doctors, and then there are medical doctors. There are a lot of MBBS doctors, pharmacologists, and there are dentists, and there are Ayush doctors like BHMS, BAMS, and others. So you will see that there is a huge bag of science applicants who are in this space. So therefore, I feel courses really help. If someone's coming from a MBBS or a pharmacology background, they may probably get an entry without a course. But as I see, I think pharmacologists are the ones who actually get that entry. For the others, I think courses are really beneficial. And apart from, there are certain courses online which give you the skill upgrade, but there is one course that I am aware about which some of my friends had pursued. There's a course in Bombay in KEM Hospital. It is called as a Masters in Pharmaceutical Medicine, and this course has the eligibility criteria for all medical graduates. So
Okay.
it's a course that can be pursued by all kinds of medical graduates. When I knew about it, the course it's a 2-year course with a 1-year full-time role to be finished in the Bombay campus, and they had a 1-year role to be finished in a Nasik campus. It was something like that. So those kind of courses do help. They give an advantage. Apart from that, there are dedicated courses in regulatory certifications in regulatory medicine. I think those are the ones which help. There are dedicated course in pharmacovigilance which help. But to my best knowledge, the challenge coming here is that there are not many, or there are hardly any courses which are offering the course and giving the job placements.
That's
Okay, so if someone's looking for that direct bridge to be built, then I feel MBA stands an option,
true.
because MBA allows you to give you that entry.
Hmm.
So yeah.
That's true.
And MBAs, I think most of my friends or juniors whom I'm talking right now in India are either looking to pursue the MBA from the baby IIMs or the big IIMs, or apart from that, if someone's looking for options, GIMS is a good option, Goa Institute of Management. Some of my batchmates or my immediate juniors had looked upon, there's an institute in Pune, Symbiosis. So the MBA courses are the ones, especially the full-time MBA courses are the ones which will help you in getting into the placement circuit if you're looking at that. Apart from that, the other courses, they predominantly give you the upskills, and then you tend to hunt for the jobs on the as per the job openings, and you have the relevant experience. And in all these other courses, apart from the MBA that I mentioned, they make you do certain tasks which give you the relevant experience to put it on your CV. So I think that is how it works.
So what I
And
understand, a full-time MBA actually gives you an experience as well as a job opportunities. That is the reason you tell
yes,
them to do that.
yes. If someone has managed to get into a first job, then they could eventually consider a part-time MBA. But if you're looking for an entry, and if you feel that that entry is becoming a bit of a barrier, I think MBA really helps. A full-time MBA from a good institute really helps.
Yes, yes, yes. So now when you mention MBA is something that people can go for, apart from, for their entry into the pharmaceutical industry, what are the kind of opportunities that they get from the start, and what they can apply for, and how do they progress further?
So see, generally after getting into a full-time MBA in a good institute, your opportunities will go in multiple domains. It could go into pharma, it could go into consulting firms, it could go into digital marketing agencies, and it could go into healthcare startups, and so on and so forth. So I would be less aware about the other wings, but from what I know about pharma, so what has happened in pharma over the last decade is that a lot of complex molecules are getting developed by the pharmaceutical companies, and the pharmaceutical marketing is evolving so rapidly, and it is so much campaign driven. And because these molecules, the new molecules which are coming, are becoming so more complex, therefore if anyone comes from a medical background and then enters into marketing, they get an advantage over someone who's coming from a pharmacy background and getting into marketing. So that is how medical graduates get that advantage when they enter into marketing. And they could enter, I think first the opportunities come through sales roles, their opportunities come through BD roles, opportunities come to marketing roles, opportunities come through consultant roles. Now, depending upon what is your area of interest, these are the kind of opportunities that you will get through in pharma. And based on the opportunities you get, you could apply, and you could understand by looking at the job description what is relevant for you, what is comfortable for you, what is your mojo, and accordingly you could get the options for yourself.
You can apply for them. Yes, yes. So as you mentioned, this is one of the marketing kind of a thing. Initially, you also mentioned pharma has different kind of roles, which is also related to pharmacovigilance, if I'm not.
Yeah.
So when it comes to pharmacovigilance and research is also one space that pharma does. So if we can just understand that also kind of opportunities you get after MBA, or is it that you get it before also? And, are there any certifications for that? If you can just enlighten on that.
Yeah. So this is one option that we discussed, was on the marketing angle or to get into the business circuit.
Correct.
Okay. The other options that we are talking about is pharmacovigilance, regulatory, or medico-marketing, medical communications. These are other 3 to 4 options that remain. Okay. So pharmacovigilance is basically a team of people, as the word pharmacovigilance suggests. It's a team of people that is trying to report adverse drug reactions. And today it is a mandate for pharmaceutical companies to have these teams, so that the adverse drug reactions are captured and the adverse drug reactions can be reported. Now, in pharmacovigilance, these kind of opportunities are with the pharmaceutical companies, or sometimes very big pharmaceutical companies will have a third party outsourcing who will do these jobs. Okay, so that could be pharmacovigilance agencies. They do the same work. It is just that they are working for a pharmaceutical company from outside. Okay, so in pharmacovigilance, I think there are courses in pharmacovigilance which can be applied. There was one in ICRI course back then, which I was aware about then, but I am not into core pharmacovigilance. So there are not a lot of courses that I am aware about in the pharmacovigilance space.
Correct.
Okay. The space that I am more into, which is my area of experience, is what is medico-marketing, and which is medical communications, as you call it. So both these are skill-based courses. So generally you can do online courses, and you can get the relevant experience, and you could apply to jobs, and that's how you generally get into it.
So now when you mentioned about medical, you mentioned into medical marketing and communications. After MBA, you can apply for these kind of courses.
With MBA also you can apply, and even without MBA, for these kind of courses, you could try and apply.
Okay. And what are the kind of roles that people can apply for? So, understanding what's the role here. So what
So generally the kind of roles that people can apply starting off could be executive medico-marketing, or manager medico-marketing, or medical manager. These are the words which I'm leaving, which could help, which you will find in the designation when the openings come. And there is something called as medical advisor, which the term that multinationals use, based on which you can apply and you can get the relevant job openings and you could get the interview. But the whole idea is there are no dedicated courses for this, especially in the offline space. Apart from the KEM course that I'm talking about, the KEM course that I referred to is a course which allows people to get into pharmacovigilance, clinical research, regulatory, as well as medical marketing and medical communications. This is one course called as Masters in Pharmaceutical Medicine, which can help you. But apart from that, you could, without a course, with the right skills, you could apply for these positions. And the skills can be developed by learning from certain online courses, which can be available, by understanding what the role is like and doing the necessary, reading which is required for those roles. That could probably help.
And this is very interesting to know. So now, understanding the kind of roles that people can apply for and apply for them, what is the kind of pay scale that they can expect with this?
Okay, so very broad question, and it's very different across all wings, to be honest. So I think marketing, the scales are very different and very high, especially because there you are finishing your full-time MBA. Right. So that would be very different. Pharmacovigilance, I'm not aware about the scale bent. Okay. Regulatory, I'm not aware about the scale bent, because those are not areas where I have been. And medico-marketing is the area where I work. Okay. So I could share for this particular wing only, to be honest. So I could say very broad again, because people come from different experiences. And it depends upon which company is hiring you, Indian company, multinational company. It depends upon which therapy area are you hired for. Okay, there are certain therapy areas which are very hot, so the pay scales vary for them. Apart from that, it depends whether you are hired for a metro city or a 2-tier city. So these are many factors which are variable. So therefore, I would give brackets which are very broad. So I think freshers can get in between 4 and 7 lakhs per annum. And over a 8 to 12 year career progression, I think the growth could be in the space of 18 to 25 lakhs per annum. And of course, there are people who go on and on more than that. And most of these people could be MD pharmacologists. And a lot of these people, after 7-8 years, maybe they diversify into different areas. Like today, even I have done a bit of diversification beyond core medical marketing into certain special projects, like new product identification. And those are areas that will open up as you go in. Okay, so my point is that after 7-8 years, you might understand where you stand. Okay, so this is how the progression goes. Of course, there are some people who go beyond 30, 35, and but that's a very small number. So I think I would like to keep the range to my best knowledge in this value that I shared with you. And I think someone on your platform even said 1 crore, but I'll be looking to find that person when I need a job change. But but I'm sure someone would be getting it, but I think it needs a lot of diversification.
That's good. That's nice to know, especially the pay scale that you mentioned.
Yeah.
And so now, understanding that with this kind of pay scale, as a doctor, we are always trained to treat patients clinically. So this is something that we have discussed. What is the kind of mindset that a person should have when entering the pharma space? So, just post after graduation, what you're trained for and what pharma wants from you is very different. So what do you suggest all of those students who plan to enter the pharma space and are thinking to what kind of mindset should they have and what they should expect from the pharmaceutical industry?
I think that's the most important question for this portal, right? Because eventually people on your platform would have I have heard a lot of people talk on your platform, and after listening to all 25-50 videos or 5 to 7 videos of people coming from pharma, everyone will say everyone is telling a different story. Okay, so I think what really matters is your mindset, and different things work for different people. but I would like to share what worked for me. And the first thing is very important is you try and find out what you like doing. Okay, because we are living in a very competitive world. You will not be able to perform consistently, optimally as per the requirements of the industry if you don't like doing something uh, that you're doing. Okay, the corporate life can be really very aggressive. Okay, over a period of time, especially in pharma roles across different wings, the pressure is different. Okay, so that is first thing. So really find out what you want to do with your life. But the second most important thing that I think worked for me, and I know it's very tough for us to figure out, is to figure out very early whether you want to be in pure clinical practice or whether you want to go beyond clinical practice. Okay, and I know we have a lot of friends who want to do both, and we have a lot of friends who want to do one, and they want the one to support the practice, and and some of them decide it after 5 years, and some of them decide it after 3 years of passing out. And it is a very tough call, because as 17-year-olds, when we all entered medical college, we had never dreamt of entering a corporate world or not seeing patients, and we had never imagined. So that thought itself for a lot of people makes them feel that they have failed in such way, in some way. Okay, or life did not go as they planned it in some way. So I really feel it is very important that you figure out whether you want to pursue clinical practice or you want to go for non-clinical options. It's a tough question to answer, needs a lot of reflection, but I really would like to share that the day you solve this knot in your head, it opens two entirely different worlds for you. Because then you will give all your energy and resources to medical practice, or you will do everything that is available for you in non-medical practice. So the horizons will widen. Okay, if you are looking at doing both, okay, that I want to do this part-time, I want to do this as a side gig, I want to do this as a freelancing, I want to share what happens. Okay, then you are a part-time doctor and a part-time whatever, a part-time regulatory writer, or a part-time medico-marketer, or a part-time medical writer, or yeah. So now what is happening in both these spaces? You are competing with people who are full-timers. You are competing with a full-time practitioner in practice, and you are competing with a full-time industry person who's working in industry. So somewhere, you are not all into it, and that will affect you in terms of growth. That will affect you in terms of opportunities, because whenever anyone is enrolling you as a freelancer, part-timer, side gig for a medical doctor who has a medical practice, somewhere they are aware that this guy would have his priority in medical practice. So I think, and I know a lot of friends who are doing it and balancing it, and they like doing it. So if you are comfortable doing both and you want to manage doing both, it is okay if it suits your life situation. But I feel if you do one, the growth curve can be totally different in terms of where it takes you. So I think that is something which was very tough for me when I was in my last years of medical college. So I think that is something I would like to share with our viewers, that get that sorted. And the last thing that I would like to say is find a mentor. Uh, if you find a mentor who will guide you in the right direction, then that will also make your journey easier. And I was able to find one who guided me and who helped me enter into pharma very early. So I'm sure in our routine medical colleges or hospitals, we meet with a lot of doctors and a lot of people. And I know careers of a lot of my seniors who have really bloomed because they found the right mentors at the right time. So I think it all boils down to three things. First is you have to figure out what you like, because only if you like what you are doing, then that passion will come out. And second is you have to find a mentor. do, whether clinical, non-clinical. And third is find a mentor. I think these are the three things that worked for me.
No, this is very interesting to know and very interesting to understand. How did you, just jot down 2-3 points. So lastly, you mentioned finding a mentor.
Yeah.
Finding a mentor is not an easy task.
Yeah.
How do you suggest people finding a mentor? Because this is something which is not easy to find. Yes, some people are lucky to find.
Yes, I think it depends a lot on luck. But how do we increase the chances is, I think, by networking, by being open about what you are telling people, or what you are expecting. I think if there is a sense of sincerity which people will pick up, and then that is how they might help you. So I think networking really helps. And then when if you are very sincere and open-minded about sharing what we are looking forward, then maybe things start working out. I think maybe this is how it helps, but I think it's purely about luck. Like the mentor whom I met him because I was working with him as an intern. I was a physician assistant with him, right? And he eventually became my father's my father's doctor. So he became my family physician, and that's how it worked. But whatever, there's no algorithm for it to. But I think trying to network with more and more people, I think extroverts benefit, or selective extroverts benefit from that a bit. Could really, I think medical people have less of it. So I think it makes sense that we tell our stories and what we want to do, where we want to go. And I think one other thing, probably if I can add as I talk to you, is not be restrained about sharing if you are looking for different options. Okay, sometimes I know a lot of medical doctors, my friends, seniors, juniors, they are awkward when they want to discuss these options, because they feel, I entered a medical college, no, so I should only discuss practice options. So these options are sometimes, very hush discussions, and you're not discussing it openly. So I think when people discuss it openly, it really helps. Yeah.
No, that's true. That's completely true. This is something which I think we as doctors need to understand from maybe engineers or different fraternity people, that networking is very, very important. That increases opportunities and increases your chances to get at better places. This is something, I'm happy to know the kind of journey that you have gone through, the kind of opportunities that you have discussed here. I'm pretty sure this is amazing to know. Anything one-liner from your end, and advice to the current students who are confused, who do not know what to do, something from your end?
I think we've summarized kind of well, but I think the most important thing, apart from all the technical and the career and the job related or the career related and the wings that we decided, that all could be secondary. I think very primary for everyone would be to get the right mindset about what you want to do with your life. The faster you are able to figure it out about what you like and where you want to go, I think that decision opens up everything, because eventually everyone will have a different journey. Okay, and we have limited time, so I'm not able to share. My teachers have shared with me some amazing examples of people from my college who went to amazing places, and I must tell you that everyone's journey has been phenomenal, and it has been different. So I think figure out what you want to do. If you are planning to do your MBA, okay, understand what a MBA professional does during the MBA. Understand what a MBA professional is going to do after. Talk to people who have finished their full-time MBA. Okay, if you want to do medical content, talk to people who are in the content space. Understand, do you love content? Do you really love content? It should not be a jazzy thing. Okay, I want to do it. Okay, so I know a lot of my friends, who wanted to do healthcare MBA after passing out, or hospital MBA after passing out, because it had a word health in it, or it had a word hospital in it. Okay, so, as medical doctors, we are very much attached to things like those, but I really feel deep dive, dissect. By the time you are an intern, you should have this figured out. It really helps. And obviously then everyone has their journey. People figure it out late as well, and they still have a beautiful journey. But if you are able to figure out these things, it helps you get on your options and explore well. So, so I think my key message is try to understand yourself and try to understand all the options with a deep dive. And that can be only done by upskilling yourself, networking with people, going on LinkedIn. It is such a wonderful platform. Yeah. So, yeah.
No, it's aptly said, as you mentioned, deep dive into what you like is what first you have to do. It's okay not to know now. It's okay if you have not figured it out.
True.
But keep on networking, keep on having different experiences, because until you have different experiences, you will not know what you like.
Yes.
So have different experiences, know what you like, and the point you know what you like, just go deep into it and explore that.
Yes, exactly. I know a lot of people doctors who entered pharma, did it for a couple of years and were unhappy and eventually quit. So, people have even had such journeys, and that is no fun. So it really makes sense that you really figure out what you like by trying multiple things early. When you try multiple things early, it gives you an exploring opportunity, and then you will eventually settle with something.
That's true. That's true. No, it's so nice to know, Dr. Jeegar, from what you have experienced from your learnings and how you're spreading it to the current students, basically, so who are in that journey, who are confused, which I think all of us were when we passed out after graduation,
including us. Yeah, me as
yes,
well.
and everybody is. So being confused is not wrong, but yes, figuring out is something that you have to do, which is your responsibility. And so we are here to help you out in whichever way you want us to. And so Dr. Jeegar is also here for all of you to discuss his journey. Just a small initiative for all of you to understand what kind of opportunities are there in pharma. And thank you so much, Dr. Jeegar, for discussing that. It was truly very nice to know your experience and how people can figure out their journey.
Yes, indeed. Thank you so much,
Yes.
Dr. Ayushi,
Yes.
for having me here. It was indeed a pleasure. And I think it's a wonderful platform that you created. So more power to you.
Thank you so
Thanks.
much. And thank you
Thanks.
so much, everyone, for joining us here. I'm sure this discussion might have helped you to understand what kind of mindset, what kind of things that you need to decide initially, and understand how to take your career further. When it comes to pharma, what things you can do, what are the kind of opportunities there, how you can explore is also we have discussed. So do share it with your friends and colleagues. Do share it with everyone who is confused, who are still there in their figuring out stage, or who want to enter into pharma. And do share it with them so that it can help them as much as it is helping you. So thank you so much, Dr. Jeegar. Thank you so much, everyone, for joining us today. Yes.
Thank
Bye-bye.
you. Thanks, Ayushi. Thanks a lot.
Yes.
Have a great Sunday.
Same to you. Same to you, sir. Thank you so much.
Live.